After many months of negotiations, Scripps Health and Anthem Blue Cross are parting ways in 2025. The move potentially affects 125,000 San Diego patients.
CBS 8's Brian White is working for you tonight to find out what's next for Scripps patients with Anthem Blue Cross coverage.
That's right. Any hopes of a last-minute deal that would have kept Scripps Health in network for Anthem Blue Cross fell through on New Year's Day, leaving thousands of San Diegans in a very tough spot.
It's stressful, and it's also, I'm really mad.
New year, but no deal. As of January 1st, Scripps Health doctors and facilities are no longer contracted in network for Anthem members.
It feels very, I guess, uncertain, and that we need to start over with everything.
Rhonda Guadarrama has been a Scripps patient for 12 years, and she says she's always received excellent care.
I trust Scripps. I trust my doctors, so we would have to pay out of pocket, which I don't even know how much that is or what that looks like.
People on HMO plans lose access to Scripps care altogether, but those like Rhonda with PPO plans who want to continue seeing their Scripps doctors will now have to pay a lot more to go out of network.
I feel bad for all the people who are, undergoing cancer treatment or waiting on the transplant lists, or, their lives are certainly more upended than ours.
I checked. Some patients may qualify for extended in-network coverage with their Scripps provider by applying for continuity of care coverage from Anthem, which is typically reserved for patients like pregnant women and those undergoing cancer treatments. I reached out to Anthem Blue Cross. A spokesperson told me negotiations fell through because, quote, Scripps demanded drastically increased prices for patients covered by Anthem, increases that would have led to higher out-of-pocket costs for our members and would have hit area employers particularly hard. In response to that, a spokesperson for Scripps Health told me, quote, Scripps's focus was to change Anthem's bureaucratic policies that cause unnecessary delays, burdens, and barriers to patient care. It is disappointing Anthem was unwilling to reduce those barriers and offered rates below healthcare inflationary costs. As for Rhonda, she checked her online portal. Her primary care doctor is no longer listed, and now she has to find a new one.
I am probably going to be in a very long line of people trying to figure this out.
Despite these changes, emergency care remains unaffected. Paramedics are still free to take patients with emergencies to the nearest hospital. Working for you, Brian White, CBS 8.
Thanks, Brian. And remember, if there's something you'd like us to look into, you can email us at workingforyou@cbs8.com.